NBC News confirms contact tracing is now running across multiple countries for passengers who left the MV Hondius before the first case was ever reported, and that backward trace is the whole reason Andes virus is a different story. This is Hantavirus Watch. Today, why a passenger manifest sweep makes sense for Andes when it wouldn't for Sin Nombre, and where the ship goes from here.
And the ship's headed for the Canary Islands. So Spain, which already has a confirmed patient in a military hospital, is now the destination too. That's where I want to start.
Right. Let's take the trace first, because it tells you what limited person-to-person spread actually demands. Here's the operational reality. Officials aren't just monitoring people who got sick. They're tracing backward to the contacts of people who didn't yet know they were infected. That only happens with Andes.
Okay, but say that part out loud. Running a manifest trace means somebody believes person-to-person transmission happened on board. Has any agency published that, or are they just running the protocol out of precaution?
That's the honest gap. The step back today lays out the biology. Andes is the one New World hantavirus where human-to-human spread is documented, but documenting the route is not the same as confirming it happened on this vessel. The trace is built around that hypothesis.
And the timing is the killer. Passengers scattered before the first confirmed case. So 6 or 7 national health systems are now working backward from a date nobody officially named until this week.
That's where the 42-day incubation window stops being a footnote. People dispersed while they were still inside their own exposure to symptom timelines. That window is what every public health clock is running on right now.
Virginia hedged more cases possible back on the 7th and got called soft for it. Turns out that hedge was just correct. They were describing this exact dispersal.
Right. And when the vessel docks in the Netherlands, RIVM's twice-weekly monitoring protocol, the one we covered June 8th, is the framework that's supposed to catch it.
So Spain's getting hit twice. A patient on compassionate use favipiravir and an arriving ship to manage. Is their health system being asked to do 2 jobs at once? Or does an empty ship docking just mean paperwork?
If the passengers are already gone, the vessel is mostly a jurisdictional handoff. The people are the caseload, and they're not on the boat anymore.
Then here's my standing problem. What does a clinician in one of these trace countries actually reach for when a flag contact walks in? The route's confirmed now. The treatment guidance still isn't published.
And that's the tension the week has built to. We have the vocabulary now. Strain, confirmed versus suspected, the monitoring tier. And today it matters. The trace follows directly from which strain this is. More analytical clarity, Brian, not more alarm.
Clarity, sure. The geography question just stopped being speculative. It's the active problem now.
Matt Bodner, writing in NBC News.
The cruise ship at the center of the Hantavirus outbreak is heading toward the Canary Islands in Spain. Contact tracing is underway in multiple countries, including the United States, after passengers left the ship before the first reported case.
NBC News confirms it now. Contact tracing is underway across multiple countries, including the U.S., for passengers who left the Andes virus ship before the first case was ever reported. That's what person-to-person tracing looks like. You're not just watching the symptomatic, you're working backward to contacts of people who didn't yet know they were sick.
And that's the geography problem I've been circling all week. Passengers scattered to their home countries inside the incubation window, and now somebody's chasing them down from a date nobody officially named until today. Paperwork doesn't begin to cover it. That's a real chase.
On the date, yesterday we were asking whether those national contact tracing clocks were coordinated or just running in parallel. NBC describes it as one operation across multiple countries. So yes, coordinated, formally underway.
So Virginia's whole more cases possible hedge from last week? Turns out that wasn't hedging. That was someone reading the manifest correctly. And the ship's heading to the Canaries, so Spain's running a compassionate use favipiravir case and prepping to receive the vessel. Every Hantavirus story I've ever heard starts with someone cleaning out a barn or breathing in mouse droppings. So why are health officials doing international contact tracing across a cruise ship's passenger manifest like this is a respiratory virus?
That instinct makes sense, because for almost every hantavirus strain, rodents are the root. You breathe in contaminated dust, and person-to-person spread just doesn't happen. Andes virus is the known exception. The CDC says it's the only hantavirus strain documented to transmit from person to person, which is why the MV Hondius cluster triggered contact tracing instead of just a rodent control advisory. By early May, NBC News was reporting at least 11 passengers with confirmed Andes virus and 3 deaths, with the latest confirmed cases all among people who had direct contact with other patients on the ship. The qualifier officials keep repeating is important. Transmission appears to require prolonged, close contact. The CDC's public health assessment, cited by ABC News, says person-to-person spread is relatively rare, and that there's no documented evidence of airborne transmission the way you'd see with COVID. And from the 2018 outbreak in Epuyén, Argentina, studied in PLOS neglected tropical diseases, we know that even when Andes moves person to person, it took quarantine measures, contact isolation, and active clinical monitoring to stop further spread. That's basically the playbook now running across the US, the Netherlands, Germany, Singapore, Argentina, and other countries where Hondius passengers disembarked.
So if close contact is the risk threshold, what does close contact actually mean on a ship where 150 people are sharing dining rooms and corridors for weeks?
That's the question investigators are working through right now. The cruise ship setting is genuinely novel for this virus, and officials haven't pinned down a precise exposure definition for this cluster yet. The thing to watch is whether contact tracing turns up secondary cases among passengers who weren't in the same immediate space as confirmed patients. That would tell us a lot about how broadly close contact has to be defined for Andes virus in an enclosed environment. The BBC reports that officials still say the risk to the general public remains low. But if you were on the MV Hondius, or you know someone who was, the guidance is clear. Don't wait. Contact your local health department or a clinician directly.
If you like keeping up with a fast-moving story day by day, try Musk v. Altman Daily. Daily court watch on Elon Musk's trial against Sam Altman, OpenAI, and Microsoft. Find it wherever you listen to podcasts. You'll find links to every story we covered today in the show notes. If something caught your attention, they're there for a closer read. That's Hanta-Virus Watch for this Wednesday, June 10th. This is a Lantern podcast.